the latest technologies that are available to manage cancer, or to say that these are the modalities that have been recently done or the innovations that have taken place, but most importantly to discuss the topic saying, cancer is conquerable. So I think this is really what we are facing, and this is what we would like to address and see what we can do together. If you look at the challenges, as Dr. Srinath Reddy said and Preeta stressed, what we have today is a triple burden. We have the burden of old communicable diseases, we have the burden of reintroduction of the infectious diseases, and of course the big threat of the non-communicable diseases. You know, this is something which not just India, several countries across the world are really facing this big threat. Can we do something about it? I think we have no choice. Why we have taken this up? Because I think if we do something about it in India, if it's right for India, I think it's right for the rest of the world. It's purely with this. I am one of those who believe that the Indian doctors, Indian scientists, Indian thought leaders are second to none. What we needed is to bring all of them together and say, here is the major threat that the nations are having. You know, several millions, 35, 40 million people are dying of NCDs each year around the world, almost wiping out one nation. You know, if that's the threat that we have, what is it that we can do in a collective thinking and bring about a process who should do what? But I think the most important part, I think I am happy, we didn't say the biggest collaborators that we have is the media. Because it's you who are going to be our biggest partner. We have the knowledge partners, we have the industry bodies, but most important, I think we have the media who will translate what we think will change in addressing this huge threat that the 21st century health challenges are facing. The very first thing that we believe is what Dr. Srinath Reddy again was saying is, what do we do about the primary care? Can we address this primary care so that it reaches everybody, and along with it can we bring the preventive health care to reach people? And how do we get everybody to bring this huge awareness of this triple burden that the country is facing? This is where I think we don't need big minds, but we need big push into society, push into people that we are responsible for ourselves. And then the equal responsibility is with the healthcare, who are delivering the healthcare, and the governments which are doing the governance in health. So I think with these three partners, media should make it very convenient for us, saying we can do this. But what I would like to end by saying, and I'm going to say it now, is we have no choice. We have no choice but to face this big threat that we are facing. This is why we took the first of the four initiatives that they're going to do is on the control of NCDs through primary and preventive health care. There are many issues, as I said, the Cancer Conclave, that cancer is conquerable. They have given us 10 suggestions. We are going to analyze how these 10 suggestions that they have together formulated, and how do we take this forward. Do we follow the Bhutan's example of banning tobacco? That's one of it. You know, the tobacco-related cancers are numerous. But banning it certainly is going to make a huge impact for those who are vulnerable for tobacco-related of cancers. But there are many such things that we could do, but more importantly, I think, is to see how do we bring the individual into this. That's where our second thought process is to see PPPP, 4Ps. Private-public partnership was the thing which the nation was talking about. It worked. It worked, and it brought about all of these changes. So they said, if just now Srinath Reddy said that the blindness program, it couldn't have succeeded but for the PPP. But we also know that India is proud that we probably have eliminated polio. Not probably, we eliminated polio. So these are all credible marks. But what we believe is if we include another P, that is this individual. Because so often all of us are like you and me. We believe the disease hits only that guy's, heart attack is for him, stroke for him, accident for him, nothing for me. We all have this immortality feeling. But unfortunately, we don't follow this for other things. If you have a car, if it just misfires a little, immediately you send it for a checkup. Yes or no? So this is happening. You look after your pets so well. Even if they sneeze, immediately you want a doctor to see. But unfortunately, the huge creation that our Creator has got. You know, I am a believer in God. I say what God has given us, this tremendous creation, we must also participate in looking after it. Those who don't believe in God, think of the Creator who has given us this creation, and I don't know how many of you know the cost of your body. Everybody says it's priceless, but somewhere along the line I'll tell you the cost of your body. But I think if you have that such creation, it is our equal responsibility to look after it. This is where I think that PPP is going to make a very significant difference in many ways. But first, of course, is to see how do people, what do people need to do? For example, for gastrointestinal illness, they say if you have clean water, you probably eliminate about 200 million gastric ailments. But just washing hands or boiling water, you say you can eliminate more than 50% of these. So these are all individual, and then knowledge given to them for participation. So I think there are many things that we are going to bring about, but it's going to make it so easy for them to say, if we do this, together we can fight this huge threat, which is going to evolve itself as a pandemic if we don't do anything about it. But I know our governments are always responsive. You saw, but all, just now, universal coverage is one of the things that, like that, several things. Our Planning Commission has increased the allocation for health to almost 2% of the GDP from 0.6 or 0.8%. But I think all of these are happening. What we are wanting to do is how can we quickly activate the private, public, people participation in this so that people also get directly involved in each of the decisions that are taken. So I think we are going to play a very significant role to give 1, 2, 3, 4, 5 things, how to avoid, what can we do to avoid heart problems. You know, in this just talking about just our hospital group, we have seen several hundred 30-year-olds who came to us with a heart problem this year. Some of them never reached us. This was never there when Srinath was in college or when I was in college. We have never heard of 30-year-olds getting heart attacks. But that numbers are increasing. So we know that, that if we bring this awareness and if the people know what's the, the heart risk factors and what can they do to avoid it. Most of them are avoidable. If they have blood pressure, take medicines, avoid salt, go for a regular checkup. If the incidence of diabetes is increasing, take care of your sugar, and take a few other steps which the doctor tells you. Like that, I think in each of these, there is a prescription which will not eliminate the NCDs, but certainly we can push the 30-year heart attack to 60-year and definitely reduce the incidence of sudden deaths. I am very fond of a city called Seattle in US. Whenever I go there, if I have a chance, go there the previous night, 4 o'clock in the morning, you get up and go onto the streets. You will see a number of people walking, running, dancing, singing away. You know what they were 30, 40 years ago? Their cholesterols were over 300. Together they resolved that they should go on diet, they should go on exercise, and take a few measures, medicines if necessary. And all their cholesterol, average cholesterol levels have dropped to very significantly to 100 plus. But most importantly, the sudden deaths from heart attacks have drastically dropped. So this is not done because of governments. This is done because people participated in this. These are some of the important practical measures that we are going to bring, and so that everybody participate in making a difference, not just by improving the healthcare facilities that we have. I think another important thing is, we have the technology. We are commendable that our Minister Sam Pitroda one day announced every 6,000 Indians will have a node of the National Knowledge Network. I think that's a tremendous boost if you can use those nodes, and if you can translate, if health can ride on those nodes and bring this awareness to people and tackle those issues, before any one of these breaks out, I think it's going to make a very significant difference. And finally, I think healthcare is not only one of the largest industries in the world, but it is one of the greatest beneficiaries of humanity, because it provides not only takes care of health of people, but it employs the largest number of people in the world. So I'm happy to see Dr. Shenoy here, Mr. Shenoy, Health Human Skills Development. This is where I think we need to accelerate and train health skills across the board. I think Public Health Foundation is also involved in it, and they have defined, or they're defining 21 courses in healthcare. If you can train millions of these people, first, number one, we were going to have a gainful employment. But more importantly, I think these will make the significant difference in developing better healthcare for all people and greater accessibility for all. So I have no doubt that what we are trying to do is a thing which probably we could have done yesterday, but I'm glad that we have all come together today, and I congratulate everyone for this great partnership. But what is important is, how do we take this great partnership to make that big difference that in facing the 21st healthcare challenges? As I've said before, it's not that we can, but we must do saying we can, and we will. I think with that great determination, the efforts that have gone in to bring all these wonderful people together, to draw these various recommendations will be very, very helpful in our journey for better health of the nation. And I think, I've said this many times, what's good for India is going to be good for the rest of the world. This is where I think what we're going to do is to see what are the things that we are going to innovate. It is not going to be major scientific innovation that we need to make. There could be several simple things which the nations across the world could follow. As I referred to that cancer conclave which we had a week ago, there were a number of ministers from various countries, South Asian countries, African countries, all of them said, we look to India for health for our people. The next thing which they said was, we look to India to train our healthcare people. The third thing they all said was, we look to India to see how we can address the health issues of our country. So I think we have already been recognized by the world, saying that we can make a difference in them. I have no doubt that we live up beyond their trust in us, and I'm sure whatever we have done will make a very significant impact in impacting the health of not just our nation, but of the nations across the world. God bless. Thank you.
Thank you, Karan. Namaste. Good afternoon. It's indeed a privilege. This is a really exciting afternoon, I have to say, because in this hall, under one roof, we have some amazing talent. We have our distinguished guests, the representatives of the electronic and the print media. We have the 5 industry associations. We have our knowledge partners. We have indeed a very distinguished gathering. And of course, we have 2 very eminent cardiologists. So not only do they have a common name, but they also have this passion of having thought about the heart since they were in medical school. And what we are trying to do here is to create something which hasn't really been done before. And if I were to quote Helen Keller, she said that alone you can do nothing, but together you can do so much. And this conference is going to be an example of how collectively we can achieve so much. We're going to have 4 amazing sessions, more than 20 international speakers. We're going to present 80 case studies from across the world, and very importantly have 4 position papers that we will hopefully disseminate to the industry, to the community at large, to the government, to the non-governmental sector, and to academic bodies, looking at the big challenges that we have: NCDs, non-communicable diseases, the problem with universal access, the huge shortage that we have in health, human resources. We will also talk about PPP, and we've added a 4th P, which is people. So it's public private partnership of the people, and the 5th and the 4th P is very important. So we hope that these 4 position papers that we arrive at will actually help create the roadmap on how we can change healthcare. It's indeed a privilege to introduce Professor Srinath Reddy, who everyone knows. He's an eminent cardiologist, was the head of cardiology at the All India Institute of Medical Sciences. Currently is the president of the National Board, which provides training programs across the length and breadth of the country, across nearly 40 specialties and super specialties. He's also the president of the Public Health Foundation of India, and as we know, that's an organization that has done some remarkable work in the very short time that it has been in existence, and has now been globally recognized for its work in public health. He was also the chair of the high-level expert group on universal access that gave its recommendation to the Government of India. So may I now invite Professor Srinath Reddy for his opening remarks.